Well, we'll get going. We are being recorded. So while we're a small group here, I think the information that we have being shared is going to be very valuable, and hopefully other people will also join later and watch the recording. This session is being closed captioned. If you look in the chat box, you'll see the closed captioning information. I'm Rebecca Levin-Nyack. I am one of the board members of Philadelphia Family Pride. And this session is on COVID-19 and kids. Our presenter is Dr. Mario Cruz, who's the director of Philadelphia Fight Pediatrics. While we're in this session, we're going to keep, unless you have something that you want to ask, please keep your video and audio off. If you have a question at any point, you can write it in the chat, and you can also use the button to raise your hand. If you have any questions about how to use the closed caption, it's in the chat. You'll see that there are directions on how to use the closed caption if you want to see that. And there'll be a full transcript. There's a link. So with that, I'm going to turn it over to Mario to present.
Hi everybody, happy Saturday. I'm happy to be here. I just wanted to, it's an honor to be here. My first conference was last year, and I learned so much and was so grateful for the experience. And I was meant to be there for 2 hours, and I ended up being there all day long. This was back before coronavirus. And so the chance to present on any topic was really something that I wanted to jump at. And this one is obviously the most relevant, I think, right now. Couple things, you may have questions that I cannot answer at this moment because I need to do some research for them. So if that happens, you can always email me here at pediatrics@fight.org. And then I'm actually going to be available for the tabling event right after this from 12 to 1. And this is sort of the Zoom link for that. So the first thing I want to do is to see, just to make sure I'm on the right track, if you could in the chat box, maybe write any questions that you may have that I want to make sure I cover in the presentation. Or if you have no questions, you can type in something that you are looking forward to after coronavirus is over. Nisha says, I can't wait to eat out again. Anybody else? All right, well, I'll move on. If you have questions, feel free to add them on there. So I have no one's paying me to do this. I make no money from coronavirus or anything. So the take-home points, I just want to start off with these because in case you have to leave early, these are important. Children, for the most part, do very well with COVID, but they are by no means immune and they can spread it. But for the most part, this is truly an adult phenomenon that's really devastating our kids in indirect ways. There is no such thing as safe. The coronavirus, because of how it spreads, nothing's ever truly safe, at least right now. And so the question is really, is something risky and that risk is acceptable, or is it unacceptable? And my job today is to help you figure out how to determine what's acceptable and not. Your decisions are going to be based on your specific circumstances. Some of you might be more medically fragile than others, and that might dictate what you do with your children. But the tricky part about this virus is that what we all decide to do is going to be different depending on who we are. We have to work together. Normal is not going to come back for a while. I know there's a lot of hype about the vaccine coming out soon, and vaccines will come out soon. But for them to truly have an impact on a national scale, it's really going to take many, many months. And so we sort of need to shift from this emergency mode to sort of everyday mode and adjust accordingly. And then the last and probably most important thing is that there's much more to being a parent than protecting your kids from coronavirus. We're spending so much time protecting our kids from coronavirus, and that's important, but at the same time, that has to be balanced against the educational needs of our kids, the social needs of our kids, and the physical needs of our kids. So speaking of kids, if you have kids, they're welcome to watch the presentation. It's not going to be too dark. I do mention death or dying a couple times, but for the most part, it's got a lot of cute pictures, and we're not going to say anything that's going to really traumatize your kids too much if they want to look at the fun pictures. So in case anyone's curious, COVID-19 comes from the word coronavirus disease of 2019. It was discovered just last year, and that's why we still don't have a lot of great treatments or vaccines or prophylaxis, because we're still figuring it out as we go. 210,000 US lives have been lost, but only about 150 children have passed from this infection in our country. As we know, there's a greater burden on people of color and people who are poor, and a lot of that has to do with who is exposed. A lot of frontline workers, whether it's in the hospitality industry or healthcare, transportation, a lot of service industries. A lot of the frontline workers are people of color, and they often do not have the ability to work from home or the ability to negotiate for more time to be home. And so they are more frequently put in harm's risk, and that passes on to their kids. In fact, of the 150 children who have passed away, 87% of those were children of color. And like I said before, this has been devastating to kids because of the loss. They've lost their academics, they've lost their social events, their families have lost money, there's tremendous stress in the home, increases in child abuse and domestic violence, and most importantly, there's a loss of control. If you think you've lost control as a parent and you can't control your situation, imagine how a kid feels right now. What makes COVID unique and different than a lot of other infections, like the flu, for example, are the following 7 issues. And until these issues change fundamentally, we are likely to be stuck in this situation for a while. There is no vaccine yet. There will be. When the vaccine comes out, it won't be available for children for some time. Most vaccines start being tested on adults first, and then they transition to kids. And so that's not going to be an option for kids just yet. There are some treatments. They're, again, mostly tested in adults. As those treatments become more available, getting sick is not going to be as big of a deal because there'll be treatment. There's still not enough testing, especially for kids. There are a ton of testing sites in Philadelphia. Many of them will not test children, for example, pharmacies. And a lot of them require some hoop to jump through. So for example, you might have to, schedule a televisit or become a patient of a different clinic just to get a test. The biggest issue is that it's contagious without symptoms. It's essentially invisible in that way. You could spread the virus to people for 3 days and not have any symptoms at all. And then all of a sudden you develop a fever. But meanwhile, you've already spread the infection to 1 or 2 or 3 people. Unlike the flu, where you could take something like Tamiflu as prophylaxis to keep you from getting the infection, we don't have that for COVID yet. And so we have to resort to these very primitive efforts to keep us safe, like quarantines. It's airborne, which also makes it pretty unique because it can linger in the air for hours. And then the really tricky part for medical providers is that the symptoms are pretty nonspecific. Fever, cough, diarrhea, belly pain, sore throat, those can be signs of just about any other infection. And so it's really hard for us to tell what's going on. I wanted to talk a little bit about how we are doing in Philadelphia. As you can see here on the top chart, this looks way back in April and May when we were at our peak. And to the right, you have October. These are the number of positive COVID cases we've had in the city. And as you can see, way back in April, we had a ton. We had well over 500 positive cases coming in. And then we've sort of dropped down, and it's much better, but it's creeping up again. The good news, the really good news, is that our positivity rate is quite low. We're down to 2% in Philadelphia. So which means that even though we're increasing the number of people that we're testing, the actual number of people who are positive has been staying stable, which is a good sign when you think about trying to reopen things. In order to reopen things, you need 2 things to happen. One is you need to have a very low positivity rate, but also you have to have a very low rate of people being positive for the virus. And so what you see up here in this top right corner, that's not a good thing. I'm not sure how that's going to trend, if that's going to keep going up or down. That's not good, but down here, this is very good. The other tricky part about COVID is that there's so much information about it, and it's really hard to know what to trust. I bumped into this article the other day on my Facebook feed. It was from The Atlantic, and it said, "Schools are not super spreaders." And the problem with this is that the title is so clear that if you don't actually read the words or read the articles from which this article was written, it might give you a misleading understanding of what's going on. Nothing about COVID is that simple. And so my strong advice for you is if you have questions about anything, please ask your medical provider. Medical providers know how to examine literature. They understand that to know what to do, you have to read the entire article. And not just that, you actually have to discuss the article with peers. And unless you are able to do that yourself, you really should be speaking with your medical provider about things that you come up with. You can email your medical provider, you can patient portal them, you can call to make a televisit. But if you're going to make a substantial change to your lifestyle based on something you read online, I would strongly encourage you to reach out to your provider first. This is a picture of my son here. His name is Dominic. He's pretty good wearing his mask. And the question that comes up a lot is, are kids immune? They're certainly not immune, but again, they do much better than adults. They can spread COVID, which is why they should wear masks, but they don't spread it as effectively as adults do. Kids can and should wear masks. The only reason a child should not wear a mask, there's a couple of. One is if a child is unable to remove a mask from their face. And then the other one is if behaviorally they're unable to keep it on. I'm thinking about kids who have like significant sensory issues, like a child on the autism spectrum might have difficulty keeping a mask on. And that's a problem because the mask has germs on it. It has germs from other people and it has germs from you. And so if a child is constantly touching their mask, now their hand becomes what's called a fomite. The hand becomes a spreader of the infection. And so it defeats the whole purpose of wearing a mask in the first place. But otherwise, really all kids should be wearing masks, certainly above age 2, unless they have any of those issues. There is some conversation about do masks. Some people are nervous about masks because they think that it retains your carbon dioxide or carbon monoxide. They believe that when you breathe out, you don't actually expel all of it and the mask keeps it in and makes you sick. Anyone who knows a surgeon or a surgical nurse knows that you can work for 10, 12, 16 hours with a mask on and be just fine. So that is not true, but that is something that's circulating in the literature. The other thing we know about children is that the older you get, the more likely you are to spread the infection and get infected yourself. So middle school and high school kids are much more likely to get infected and spread it than smaller kids. And we don't know exactly why yet, but we know that from the data, that seems to be the case. Most kids do just fine, like I said. About 5% of kids get hospitalized. And then overall, about 1 in 1,000 children who have been infected with this have passed away. This is actually a high number. It's actually more like 0.08%. But I had trouble finding a graphic to demonstrate that. So, but it's pretty unlikely that a child who gets infected is going to pass. I'm going to say this very quickly about MISC because there are questions about this. There's this syndrome called Multisystem inflammatory syndrome in children, which is a post-COVID phenomenon, which means that you get COVID now, and then a couple of weeks later, your body responds to that initial infection by an exaggerated immune response. Essentially, the immune response is going so crazy. And as a result, it causes things like rashes and fevers for 4, 5, 6, 7, 8, 10 days. It causes blood pressure changes. It's pretty rare. We are seeing it in Philadelphia. The hospitalists who I am close with, they are seeing it. But again, this is quite rare. And 2% of people who get this infection, this syndrome have passed away. But the bottom line is that kids do get infected. They get infected less than adults do. When they get infected, they do much better, and they rarely pass. And that's important to know because that knowledge is going to inform the decisions that you make. The symptoms in children are, like I said, can be pretty vague. Fever, cough, difficulty breathing, that can come from anything, right? That can come from a cold and an asthma attack. Belly pain, sore throat, runny nose, diarrhea, these are things that we've seen for years and oftentimes have never thought twice about them. What's really interesting about these symptoms is that not everyone has them. So you would think that with coronavirus that everyone would have a fever, but only 46% of children who test positive for the virus actually have a fever. So in other words, most children do not have fevers. So that makes it hard to pick up sometimes. Coughing, you would think this is a respiratory infection. You would think that most people would have coughing or breathing difficulty. But in the pediatric population, that's actually not the case. So again, it makes it really hard for us to figure out what's going on when a child has these symptoms. When to call a doctor, this is a common question. To be honest, this is a new pandemic. I would say you should call the doctor whenever you feel like it. And they should be ready to address your issues. I can't say that much more firmly. A lot of parents believe that there are rules to follow, like I can't call the doctor for this or that. I can't email for this or that. This is an unprecedented time. And so if you have a question, please, you need to call them. Even if it ends up being nothing, I'd rather you call than to leave it alone. But if you wanted some general rules, the general rules are anytime you have shortness of breath, anytime you have a prolonged fever, anytime your child has less energy, not drinking, not peeing, those are always reasons to call the medical provider, even regardless of coronavirus. A lot of you are going to have questions about, is it safe to do X, Y, and Z? Is it safe to do Halloween? Is it safe to do Thanksgiving? I believe that safe is too broad of a term. And so the better, more specific questions are the following. If I do X, Y, and Z, what is the likelihood that my child will encounter another person who has COVID? The other question is, if I do X, Y, and Z, what's the likelihood that my child will become infected? And the last one is, if my child participates in X, Y, and Z, what's the likelihood that my child or someone else will get very sick? And so if you can really think about these questions really systematically and making a decision about what to do, it's going to make it a lot easier for you to figure out the right thing to do. I like this picture a lot. It's a little bit oversimplified, but it gets to the point that all of the things that we're doing, the social distancing, the mask wearing, the hand washing, the plexiglass, all these things, they work in layers, and none of them alone are perfect in protecting your family, but in combination, they really can do a good job. Now, some of these things are not in your control. There are some extra layers that you don't see in this diagram. So for example, a vaccine would certainly be a layer of protection that you should certainly get once it comes out. Treatments are a layer of protection that is not in your control, and prophylaxis is not either. But you can control how big your social circle is and who's in it. Your social circle is so important because if you can surround yourself with people that care about you and they know the health status of you and your family, they are more likely to be responsible when they're around you. They're more likely to say, you know what, we can't get together now because my kid had the sniffles last week. And so out of safety, I'm gonna stay home. You can control how long your visits with family and friends are. We know that the longer you're in contact with someone, the more likely you are to actually get infected. And so, and you can also control the ventilation of your visits. Are you inside? Are you outside? If you're inside, is the window open? Is the fan on? These are all things that you can control. And if anyone has questions about any of these things, just feel free to type in the chat box. I think everyone knows this by now. I just wanted to remind you that the reason we stay 6 feet apart is because that's how far the droplets can get to another person by speaking or talking. And you can imagine that if this person on the left had a mask on, there would be less particles going across to hit the other person. And then if both of these people had masks on, the chance of an infection spreading is really quite low. What this does not show is that some of these particles also linger in the air, and they can linger for hours. Some studies say up to 3 hours. And so if you're in a room with someone for a prolonged amount of time, you can imagine that over time, especially if it's not ventilated well, that over time, some of those particles can infect another person. So this is a nice exercise that you might want to use for your kids if they're old enough to teach them about coronavirus. This is my son, Dominic. What we did is we took some confectioner sugar, the sugar that's on the white donuts, and we put it all over his face. And then we had him do a couple of things to demonstrate how this virus can spread. So we put it on his face and his nose, and you can tell that he's infected. And this is my son, my kid Dominic. And then he does what you're not supposed to do, which is touching your face. One of the nice things about wearing masks, especially for kids who are always touching their faces, is that even if you touch the mask, you're not touching the germs that are on your nose and around your mouth. But in this case, he's not wearing a mask. And so he touches his face. And of course, the next thing that happens is now he has the coronavirus on his hands. So with those dirty hands, he shakes my hand, he touches a doorknob, and everything he touches from that point forward, look at this doorknob with these virus particles on it. Anyone who touches that object is going to get sick. And so this reinforces the importance of hand washing. And so for some kids who may not understand why you have to hand wash, this might be a nice exercise to teach them why it is important to do that. Because even if you touch something that's dirty, if you wash your hands or sanitize your hands are still clean. And that's especially important when going in public places. Hand washing is also important because COVID can live on surfaces for a while. And so if you touch those surfaces, you can get infected. I wanted to go through some of the masking options for kids because I know that's a lot of questions. It's like, how much should I protect my kid? There are pros and cons to all of these things. This beautiful child over here does not have a mask on or a face shield. And so they're obviously at risk, but this is the most comfortable. And this kid looks the happiest. However, here's another kid who looks just as happy, and they're wearing a mask. And the mask is great because it protects you from getting other people sick, and it keeps you from touching your face as much. And the visual of wearing a mask reminds everyone to be careful. The problem with just a mask is that it does not protect your eyes. And so the eyes are coated with a special kind of skin called a mucous membrane. That's the same kind of skin you have on the inside of your nose and in your mouth. And that's the kind of surface in your body that can get infected with the virus. And so the mask and face shield protects you much better. So if you have a child who's going to a daycare center or a school, a mask and face shield is probably the best way to protect you. Because it covers your eyes and you have the mask to cover your nose and mouth. The other nice thing about the face shield is that it keeps you from touching your mask because your mask has germs on it as well. So this is probably the safest. Face shield alone, I don't like that at all really because it doesn't protect you from the airborne component of the virus. The virus can live in the air. And so as you breathe in, you can breathe in those particles. But also, the face shield alone does not protect anyone else. You're just breathing out as you normally will. And the droplets will land on the shield, but some of those small particles will float in the air and can infect other people. So I would recommend for anyone who is in a childcare facility that if it's possible, if it's feasible, to have a face shield and a mask. There's always questions about which mask is the best. N95 masks are technically the best, but they're really not for kids. They're not comfortable and they can be expensive. And if everyone starts buying these, the healthcare providers don't have them. These masks are what healthcare providers wear when they are in high-risk situations because it is quite good. Probably the best for kids are the surgical masks. They're actually the easiest to talk through, and they tend to be fairly easy to breathe through, and they're very cheap. And then the cloth masks are probably the least effective, but they're the most fun for kids because they have the most variety and you can really customize them as you wish. But the surgical masks are probably the best. You may remember way back where the government did not recommend masks. That was because there were not enough masks to go around and they were concerned that the public would take up all the masks, leaving none for healthcare providers. But now we have plenty of masks, and so you should use those. Who should get tested? Really, everyone should get tested. The reason everyone's not being tested is because there's not enough testing sites, testing materials. If everyone gets tested right now, like all at once, it could take weeks to get your results back. And so right now we're sort of primarily testing people who are symptomatic, but really everyone should get tested. The best reasons to test would be if you have a known contact with a COVID infected person. That would be an absolute reason to test. Obviously, if you have symptoms of coronavirus, you should get tested. especially if you're a frontline worker, or if you're going to school or daycare, because you need to protect the other people in those areas. And the other reason to get tested, especially as a child, is if you have no symptoms, but if you have unavoidable contact with a high-risk person. Let's say you have a grandparent who is going to move in with you, and there's no way around that. There's no way around that exposure to that grandparent. It would be very helpful to get a test ahead of time to make sure that you protect that vulnerable person. There's a ton of testing sites in Philadelphia. The website from the Philadelphia Department of Health is great. You can just Google philadelphia.gov/testing sites. Again, a lot of the sites are not testing kids. The new version of the website, however, can filter by who's testing children. And just for context, the reason why we're not testing a ton of kids right now in general is because testing itself can be a dangerous procedure for the testers. You're talking about taking someone who may have this dangerous infection, bringing it into your office, and doing a procedure that might make the patient cough, which would sprinkle the particles all in the air in your office. And that can make the staff sick, and that can make other patients sick. And so as a result, a lot of pediatric practices have decided not to test in their site because they would rather have the children test in a site that is much more able to do this in a safe way. For example, in my office, we're trying not to test at all and referring people to testing sites. If we test, we're testing people who have less symptoms, and we're testing them at like 4 o'clock, 4:30, when everyone else has gone home. So if you were going to get your kid tested, I would suggest your primary care provider first. If you have the money, the urgent care centers are often testing. They will often do tests at an added fee or with a copay. And then there's testing centers around the city. There are a couple of tests. The good news is that you no longer have to do the brain test. So here's an example of the little swab going into the nose all the way to the back and getting material from the nasopharynx. This is the back of the nose. Nowadays, you can test at the front of the nose or the middle of the nose, and sometimes even through your saliva, and get a good specimen. There's a couple of tests. There's a rapid test and there's a PCR test, which takes a couple days to come back. The problem with both of these tests is that if they're positive, that means that you have the coronavirus. There's a really good chance that it's a real, true positive. If it says you're negative, you could still be infected. So you can't trust the test completely. The best way to make the test accurate is to test more than once. So some people would say, if you test negative now, but you have put yourself in a high-risk situation, that you should test yourself again like 5 days later, just to make sure. Because if you have 2 negative tests, the chance of you truly being negative is actually quite high. So hopefully that makes sense. The question comes up a lot is, how can we return safely to school? If any of you are following, I don't know if you're following this, the NBA and WNBA, but they created what's called the NBA bubble. And that's sort of the gold standard. This is what happens when you have millions of dollars and a lot of people who are invested in doing things the right way. The NBA basically, and WNBA basically took 22 professional teams, sent them all to Orlando to play the playoffs, quarantined them, tested them daily, had very strict rules for who can come in, who can come out. And if you violated those rules, you were kicked out. And so as a result, they have all been able to play basketball together where there's a lot of interpersonal contact for 3 months without having any infections. In contrast, there are some school districts around the country that have opened up, I would consider irresponsibly, and irresponsibly means not forcing or mandating masks, opening up too soon, so opening up when the community rates were still too high. And if you do that, your school can become a super spreader. So there is a way to open schools up safely. Your school districts just have to follow those rules strictly in order to make sure the kids can get the education they need while also keeping everyone safe. So a couple things to keep in mind about schools and childcare is the best option from a coronavirus standpoint is to stay home. The next best option is to stay home with a family member, a trusted family member, or to be with a small pot of people that you know and love and that will look out for you if there's an issue. And then the last option, if you need, is to send your child to childcare or daycare, but making sure that you understand their policies for the policies that they're going to implement and making sure that they fit your standard of responsibility. You may want to consider going part-time to childcare or school, just because that decreases the number of exposures that you will have. But for the most part, if the community spread is low and the daycare and school are practicing responsible practices, it can be safe to go back to school. Here's one example of a responsible practice that a school or childcare center might implement. And this is called potting up. And so these are two groups of students in the same school, group 1 and group 2. These two groups never meet each other, and the teachers never cross cover for each other. And what happens is if one child in the group gets sick, the entire pod and teacher goes home and has to quarantine. Kids can play sports during COVID, but I would encourage you to try to modify the sports if possible. Every sport has different levels of risk. There's some sports that are more individual, like lifting weights or jump roping or doing yoga. There are some sports that require another person, like playing football. But then within those team sports, there are ways to make them safer. So for example, you could play catch with a football instead of playing tackle football or touch football. You could play soccer and practice your skills instead of playing a full game. Wrestling is an example of a sport where there's a lot of interpersonal contact, and so the risk of that sport is a lot higher as opposed to the other sports where you're a little bit more distant and a little bit more individual. So again, the best tips for reopening are having the school district or the childcare facility be very clear and transparent about when they're going to open, but also about when they're going to close. And really the most important parts of this are making sure that the community spread is low and that rates have been stable for the past 3 weeks. So in Philadelphia, for example, we have a low positivity rate, but the rates have seemed to be going higher in the past couple of weeks. And so that might give us some caution in thinking about whether or not to reopen. The schools and childcare facilities should have a very low threshold for sending children home, and they should daily check symptoms and wear masks and hand hygiene and temperature checks. Here are some examples of when you might want to keep a child home. So on the right here, we have high risk symptoms, coughing, breathing difficulty, and loss of taste and smell. And then on the left, we have sort of more low risk symptoms. And what a lot of places are doing is they're saying, if you have one high risk symptom, we're going to kick you out unless you get cleared by your medical professional. And then in contrast, if you have 2 low risk symptoms, the same thing happens. So 1 high risk symptom or 2 low risk symptoms would be the criteria for sending you home and requiring clearance to come back. And you can get clearance in one of 3 ways. The first one is if the medical provider can clearly demonstrate that your symptoms were caused by something else. So maybe you have a cough, but it's from your postnasal drip from your allergies. That would be a clearance for that case. If you get a negative COVID test, that might allow you to be cleared. But my strong recommendation for this is anyone who is sent home from school or childcare for any reason, as long as I would suggest a quarantine for 10 days for those kids, and don't let them come back for 10 days. And that's because the tests are not perfect. And so even if you have a negative test, you could still have COVID. And so for the safety of everyone else in that community, my recommendation would be to quarantine everyone who has symptoms. A lot of people ask about the holidays and what should I do about the holidays. A couple things to keep in mind. The person at most risk during the holidays is not your kids, and probably not even you. It's actually the parents and grandparents. And so the real question is, how can I protect those people? I'm much less worried about your child. The reason I hesitate with a lot of family gatherings is because when you love people, you tend to relax. And the longer your get-together is, you might relax too much. You start taking your mask off, you start getting a little bit closer, you start hugging and kissing everybody. And so it's really, it potentially becomes dangerous to have prolonged family events like the traditional Thanksgiving during this time. And I always want to remind people that COVID doesn't care that you miss your family. You know, it doesn't care that you haven't seen each other in a long time. So, you know, if you want to protect these elderly folks, the best thing I would recommend is to modify what you're doing this year. One example of that is with Halloween. Halloween should probably be modified because the way it currently happens, at least in my neighborhood in Philadelphia, is probably not safe. And so I suggest that you think about Halloween differently. As an example, think about what the goals are for Halloween. There's 3 goals, right? There's 3 goals. You want to have fun, you want to be creative, and you want to eat candy. And there's a lot of ways to do that beyond the traditional trick-or-treating. There's actually a great website from the Philadelphia Office of Emergency Management that has a ton of ideas about how to do Halloween more responsibly from a COVID standpoint. This is a screenshot of their website. It says how to have a spooky Halloween and stay safe from COVID-19. The other question is, can kids see their grandparents? And when people ask me that question, I ask them these questions in response, because the more yeses that I get to these questions, the more likely it is that your grandparent is going to be safe. They don't all have to be yeses, but as many as you can would be great. So the first question is, can you meet outdoors? Or do you have a nice indoor space with good ventilation? Can you test your kids ahead of time? Can you maintain 6 feet of distance? Can you keep the duration as short as possible? And can you try to quarantine or semi-quarantine ahead of time? And all of this is being done to protect your grandparents. When you meet people in your family for the holidays, you might realize that not everyone wants to wear masks. There's a lot of reasons for that. The first 4, you're gonna be unlikely to address in a real way. You know, some people don't believe this is real. Some people believe that it's the government doing too much stuff. Some people think that if they're gonna die, they're gonna die. And some people think God's in charge of what happens to them. You're not gonna win arguments about that. You might win arguments about the last 2. Some people say, we're all gonna get it anyway, so why not get it now? I would argue back to them that you don't wanna get sick now because this infection is still a mystery to a lot of medical professionals. I'll give you an example. If you got sick right now today, your chance of surviving is much better than it was many months ago because we know more. Likewise, if you get sick 6 months from now, your chance of surviving that is probably going to be much better than it is now because we're going to have 6 months more of experience. So you don't want to get sick right now. And even if you did, you really just want to make it, you want to prolong that infection. Some people think that herd immunity will take care of this. We don't have herd immunity yet, and it's going to take, right? So I'll give an example. About 25% of people in New York City have been infected with this virus, even after that huge spike they had. It's going to take a lot more death and dying to get to herd immunity. And so that's something that we don't want to even try to fathom at this point. Like I mentioned before, children have been devastated by coronavirus, not so much because of the medical implications, but because of what we've done to protect adults. They've been isolated, they're in cyber school, which they don't learn as well from. They're gaining weight, they're eating worse, they're becoming depressed and anxious. They are on screens all day, and they're experiencing tremendous family stress. So I wanted to go through some of this and provide you with some practical tips on how to help your kids. The first thing is you got to take care of yourself. I have so many parents who tell me that they will do anything for their kids. Well, if you do anything for your kids, I want you to take care of yourself. There's good evidence, specifically in the field of anxiety, that if you as a parent can take care of yourself and take care of your own anxiety, that will have a trickle-down effect on your child. I often tell parents also, if they have an appointment, 2 appointments at the same time, 1 appointment with their own doctor and 1 appointment with me for their child, I want them to cancel the appointment with me so they can see their own doctor. You cannot take care of your child well if you don't take care of yourself. And so that's really critically important. Children can be supported in a ton of ways. You may want to give them language to express how they feel. So for example, a child might feel sad, and that's called a primary feeling, but beneath that sadness are other deeper feelings. So you want to teach your child to say things like, I'm sad because I am disappointed that I can't see my friends at school. Or I'm sad because I'm frustrated that I have to wear this mask all day. It's really important to use this as an opportunity to teach kids to express their feelings in a real way. And you may have to role model that as a parent. As bad as the situation is, there are some COVID perks out there. As an example, most of Philadelphia learned to ride a bike this summer because the roads have been cleared and there's a lot more space and time. And so you may want to use this time to have your child learn a new skill, whatever that skill is. And you want to educate kids on COVID. I mean, you can imagine what this looks like to a child. There's some children that think that you just touch someone and you die. And so you want to teach them about what COVID is. There's a really nice Sesame Street, I guess, documentary or YouTube series about COVID. The last thing you want to do, just before I forget, on the top right, there's this screenshot of a workbook called First Aid for Feelings. And I'll give you an example of what it looks like. My son did it here. And on the bottom, I don't know if you can see this. The question is, how do you feel right now? And you can see he circled all these like really sad words. And that gave me as a parent insight into how to support him better. So there are a lot of these feelings workbooks that exist. They're easily downloadable, and you can actually use those with your kids. To support physical health, again, a lot of my kids are gaining weight. I mean, it's essentially, it happens so much that it's a normal finding right now. So what I suggest to support their healthy eating and healthy weight is to win the battle at the grocery store. Your child cannot snack on unhealthy foods if you are not buying unhealthy foods. And so that happens at the grocery store. You want to bring your kids with you to the store so that they can help you pick out foods. You can compare which foods are healthy and which foods are not. You want to get your kids outside as much as you can to the parks. It might require getting some warm clothing. You want to minimize screen time if you can. And so when you're purchasing things for your kids, playthings, I would prefer that you purchase like toys or dolls or cars or Legos instead of electronic devices to play with. Please get your vaccines and get your flu shots, the flu shot in particular, because the flu can look just like COVID. And then you want to stay up to date with your checkups. As far as academically, the best ways to support your kids are to schedule a check-in, a proactive check-in with the teacher or counselor, just to make sure things are going okay. You want to maintain good sleep habits. You might want to get your kids into a routine. So for example, they sleep at the same time every day, they wake up at the same time every day, and then when they wake up, they put on a uniform, they put on their school outfit. You may want to get them some fidget toys. A lot of kids have trouble sitting still in school. That's completely developmentally appropriate. It's not expected for them to stay still for an entire school day. And so giving them things they can play with in their hands, like Play-Doh, fidget spinners, little blocks. There's this little cushion that the kids can wear on they can actually put on their chair and bounce around on it. That might help them with school as well. Pods are really helpful if they're done right. Pods are often small groups of parents that choose to have their kids mingle and go to school together. Those are very helpful, especially if the kids are all in the same class. When kids are in different classes, it gets a little bit more difficult to manage. So the take-home points are that kids generally do well from COVID, but they're not immune by any means. There's no more such thing as safe, at least for now. It's really a matter of risk and how you modify that risk. And you modify risk by adding layers of protection, masking, social distancing, good ventilation, things like that. Your decisions are based on your specific circumstances. So what you might choose to do for your family might be different than what someone else chooses to do. Normal won't be back for a while. So we're going to be in this for a while. And then again, you really want to take care of your kids' total needs instead of focusing exclusively on COVID. So thank you for your time. That's all I have for today. If you have questions, you can email me at pediatrics@fight.org, or you can also join me at my Zoom virtual tabling session, which is actually happening right now.
Thank you. Thank you so much. That was so informative and helpful. I really appreciate your taking the time to speak to all of us. Really great presentation and great slides. I am going to put